everyone. Thank you for joining us tonight and welcome to another episode of Can We Talk? Tonight's conversation is affordable IVF, understanding your options. The decision to cover this topic is because I think IVF or fertility treatments can be very overwhelming. However, the finance part of it, I think, takes up a big portion. So we decided to cover today's talk with Dr. Yeong from IVF SG and Taoyang Clinic. And so before we start, let me invite him in and we can start today's talk. Hi, Dr. Yeong.
Hi, Kim.
Hi. All right. So thank you for joining us today, Dr. Young. Maybe before we start, you could maybe introduce yourself to people who are in the group.
Okay. Hi, everyone. Thank you for taking the time. I hope you can hear me well. My name is C.T. Yeong. I am part of IVF SG. I have my own clinic, which is Yeong Clinic. And currently, I am the medical director and clinical governance officer for Vertus Singapore. My journey in IVF for fertility spans the last 26 years. I've set up IVF centers in India as well as in Vietnam, for which the experience I feel very enriched and I learn a lot from overseas as well. One thing I believe is that the fertility treatment shouldn't be just focused on the outcome, which is obviously the most important thing. This the whole journey where you have to have the support and feel that everyone is doing their best to help you and to be well informed. And of course, we know that the journey is emotionally draining for a lot of people, especially the financial part. And hence, the team that we have in IVF SG try to reduce this burden by having this affordable IVF program that we have.
Yeah. So, today's topic is obviously affordable IVF, and IVF SG is an affordable clinic. But maybe you could also explain, what does affordable mean to you as a doctor, when you're facing patients?
So that's a very good question because we know that IVF treatment is not cheap. So to put a term affordable, at least to me, is actually to make fertility treatment available to anyone and everyone that needs it. As you know, the fertility rate in Singapore is far from optimal. And yet, there are couples who are hesitating because of cost. So I think this journey is about giving these patients the appropriate care, paying attention to patient safety, paying attention to their emotional needs, and try to be as individualized as we can without burning a hole in their pocket.
Yeah, I think that makes sense. But I think, a lot of people, when they come into fertility, and as you say, the financial part actually plays a big part. And I think a lot of patients are often very surprised how, IVF prices vary between different clinics. But maybe you could explain more into detail why, how come people can have different prices and this and that?
As you know, when you embark on a journey, you have this worry whether there are hidden costs, what are the factors that influence the IVF pricing. So yes, patients have to understand that there are various parts of the process that would obviously come into the costing. For example, like consultation with your doctor, various important tests that we need to do in order to determine what sort of situation you are in and what's the most appropriate treatment. And of course, there's the lab fees that come along with IVF. So every center would have their own little model. So it's very important that the patient actually make sure that all this is discussed fully, so that they know that which part of it is part of the package and which part of it is an add-on. So there are some centers which give a very attractive initial package, only for the patient to be surprised to say that, yes, this, if you want, you have to add this on. So I think we try to make it a seamless and transparent package for the patient. But I think that anybody who's going through IVF should make it a point to see what you're signing up for. Read the small print.
Yeah. So apart from, the financial side of, okay, knowing the cost and everything, but what other things beside the price should patients, be asking the center of, what's coming in for them?
I think the point here is not just the medical part of it,
Mm.
it's the lab part of it, which I think in any situation or any couple who have gone through fertility treatment, we realize and we must stress that the lab, the integrity of the lab, the results of the lab, whether it's ISO certified, whether it satisfies certain ministries' requirements, has to go through their own screening process. And I think that's important for the patient to understand that how good this lab is. So I think in many countries, unfortunately not in Singapore, they actually publicize what is the success rate for various labs. And it helps the patient to make an informed consent about how good this lab is.
Yeah. But in Singapore, I mean, because of the fact that we don't have those success rates, but I mean, given that Singapore seems to be quite advanced, in certain ways, usually is there a big difference in labs when we see, standards and this and that? Can there be?
I think I worked in many of the labs, used many of the labs. I would say that in general, all the labs in Singapore are all world class, and we get very good results. I think every lab is slightly different, also because different embryologists and different scientists has different preferences. By and large, I would say that all the labs in Singapore are well equipped, and they are well staffed, and they all would keep to the best treatment guidelines and lab guidelines that we have.
Okay, so that's reassuring. At least we know that wherever we kind of go, at least there's that standard of level there. But let's expand a bit more. Okay, coming back to the cost of things. Because I obviously have a lot of people who ask me. Kim, I've gone to I've asked centers for certain pricings, and they tell me it can be between 15 to 30,000, and that's a very big range. And they cannot understand where's. And then they think that, okay, there's another center that tells them 15 to 20,000. And they're like, oh, then I'll go for the cheaper one. But, what are things that, going into further detail into IVF packages and everything, what are things that usually cost more and this and that?
Absolutely. Very good question. A lot of patients would just go in only to realize that if certain things needs to be done. Hence, the earlier part of your question, which says that the patient, the onus is on the patient to actually make sure that all this is spelled clearly and to discuss with the lab or discuss with the doctor and his team what are the things included in the package. Now, there's a huge discrepancy sometimes in the, the pricing because certain labs would quote what is considered as basic, which includes things like the egg retrieval, which is what we call the egg collection. And after collecting the egg, the lab will take this egg, process, clean the egg, and do what they call the fertilization part, which in most labs in Singapore, if not all, will do ICSI. Now, ICSI is intracytoplasmic sperm injection. Now, there are various modifications of ICSI which some labs do. So, for example, like Virtus, they add on something called IMSI, which the scientists in this lab feels makes a difference. To be fair, some labs don't use it, or if you want to use this more advanced way of selecting the sperm, they cost extra. Now, some labs will put it in the package, like Virtus. Some labs will say that if you want to use this more high technology way to choose your sperm, you need to pay more. So on that aspect, the patient basically have to ask. The other thing is that assisted hatching is another aspect of preparing the embryo when you put the embryo. Some labs may find that it doesn't fit into majority of the patients, so it's not included in the package. But because you're older, the embryos have thicker zona, you may need assisted hatching, and hence you're going to pay more. So I think it's important that some of these additional processes has to be discussed.
Yeah.
And I think that the lab that I work with here is very transparent. Our counseling involve not just the financial counseling, which is just the doctor's consults, your drugs. It also involves a session with the embryologist. So all these questions can be discussed. In this age, I think sometimes the patients are better informed than the doctor, some doctors.
Yeah.
So they read about new techniques, they read about new innovations, and use that opportunity when you have the counseling session to ask and to see whether they do. Now, there are some questions, for example, like embryo glue.
Mm.
Sure that many of you out there would have heard of it before. A very sexy name, but to be fair, you must read the data. You must be scientifically inclined and to see whether there's evidence for it. So, for example, if you talk about embryo glue, discuss with the lab, discuss with the embryologist that's talking to you. Some doctors may say, yes, go ahead, do it, no harm. But some may say that, look, it's a waste of time. It depends on the familiarity of the lab using certain innovation as well. So coming to that, you need to marry the two. That means you need to discuss. You need to see whether the lab is charging what for what. And basically, that's why your range of the costs vary so much.
Mm. Medications wise, some people ask, oh, does medication cost more at one place than the other? Or medication wise, it's actually very similar, but dependent on what you use?
Right. That's a very good point. So it's also a very sore point, to be fair.
Mm.
As you know, Singapore's cost of drugs for IVF is quite a lot more than neighboring countries. And that's often the complaints that we get from patients. There's nothing we can do about it. And to be fair, most of us in private practice would tailor our costs to be competitive. And the cost of Gona-F, the cost of Recovel, the cost of Pirigon, they're roughly the same. And most patients are very clever. They will be able to compare with their friends and say that, look, Dr. Yeong is charging me X. Dr. Tan is charging me X plus one. And Dr. whoever it is. So they do find a right fit. And then for us as doctors, we owe it to our patients to charge what is norm or rather, acceptable.
Yeah. So at least we're quite clear. So there's no, in the sense that people who think that medicines are going to be like, it's because the medicines vary across clinics. It's not so true. It's actually quite the norm.
It's quite standard. Yes, you're right.
Yeah. Coming back to IVF SG, so IVF SG obviously is known as Singapore's affordable IVF clinic. It's one of the only ones that is available here in Singapore. But where did the concept come from? Why did you guys start this clinic in the first place?
The history of IVF-SG is interesting because it actually came from the model that was functioning in Australia for many years. Fertus Australia has an arm which is called TFC,
Okay.
called the Fertility Centre. And the reason why it evolved into that model was because they found that there are patients who are delaying IVF treatment because of cost. And they created this model where they have nurses doing a lot of the screening, a lot of nurses that are doing a lot of the scans. And when this model was mooted in Singapore, the few of us that were involved in the setting of it were a bit reluctant because I think Singaporeans are more picky, and not to have any disrespect for nurses, they would prefer a doctor's hand in the journey.
Yeah.
So we adopted that model with a bit of modifications. So this Australian affordable IVF was brought to Singapore, and we got the support of Vertus. We got the support of ACRM, which was the family that actually was part of the process that created this company.
Yeah.
We decided to do so because it gave us, or rather give patients an option to have an affordable private care treatment that is comparable to any private center, and also to make us a bit more competitive with the public institutions so that Singaporeans, expats, foreigners alike, we don't discriminate, you can come through. Everyone is charged the same so that there are more options to have their fertility treatment with us.
It's a very interesting concept, but however, we often get ladies who, when they hear the word affordable, they often think that, okay, it's affordable. The castle mindset that Affordable means not so good lah, you know. It's a bit more simplified. I don't get a lot of things and this and that. But I mean, maybe what do you say to that in that sense?
Well, we call it affordable, but to us, it doesn't mean lower quality. It doesn't mean less time that's spent. I think we have a history for about 2.5 years, 3 years.
Yeah.
And ask any of the patients that come through. We give them the same attention that I'll give in my private practice. And every patient still receives the proper medical assessment. We give them individualized care.
Yep.
The treatment plans are usually tailored according to them and their requirements. And we take into account their medical history, their fertility history, not just for her, but for the couple. And then we will modify some very standard protocols if needed to give them the best possible treatment and hopefully a good outcome.
So, I mean, to me, that sounds exactly what a normal private center would do. There's no big difference in that sense, right? And seeing that you also have your own private center, I think that you'd probably know best. But a lot of people ask me, you know, Dr. Yeong has his own private center. You know, why is he spending time doing this as well? Maybe you could share, you know, why?
Well, it was a decision that was taken quite not to sound altruistic, but at that point, I really thought that this would provide an option for more people to get pregnant.
Yeah.
Many people have asked me if I do this, will I not be cannibalizing my own
Yes.
private practice?
Yeah.
But I think many of us who practice fertility, our main love is actually to try to help as many people have a baby. So if you are able to do so without causing financial burden on the patient, and to be honest, not so much a loss to us. I'm at that stage in my career and where, you know, you just wanted to give patients the option. Like I say, not everybody thinks that way.
Yeah.
But that I'm quite happy and glad that I'm in this situation where I can actually facility to more couples.
I think you know, if you ask me, I think that's a very nice thing to be doing because, you know, obviously we see, you know, in our groups and everything, we see so many ladies who have to give up IVF because of the fact that, you know, I cannot afford another round. And you know, I've even seen ladies who say that, you know, I've had to sell my HDB to afford another round, move back in with my parents. The stories that we hear every day, you know, so to know that there's a center or, you know, doctors who actually care about the financial aspects, I think it brings another aspect to things, like, I think at the end of the day. Yeah. So
more of us in that mindset than you think.
yeah.
So I think Singapore situation, you know,
Yeah.
we have a declining fertility rate. We have to let the public know that no, we are on the same page here. We just need to, you know, work together. Whatever we can do in order to minimize your stress and your financial, there are options.
Yeah.
You go to public, but you can always come to us if there are certain things in the treatment cycle that you prefer.
Yeah. Yeah. So, you know, okay, obviously just now you talked about, you know, you have your IVF protocols and this and that, and, you know, talking about, you know, your standard medications or, you know, your Pure, your Menopure and all that kind of stuff. When people come to IVF SG, do they also get the same medications or, you know, is it totally different types of medications?
A very good question. My patients ask the same question.
Yeah.
Do I use generic? Do I use
Yeah.
thing which is made in some parts of the world where it's a bit dodgy? But Singapore doesn't allow that. All right. We use the same drugs, same 2-3 companies that supply all the IVF drugs. We just manage costs.
Okay.
Markets are very lean. We hope to, you know, have numbers so that we can sustain this program.
Yep.
So yes, that's how we do it. Yeah.
Okay. So that's reassuring. But yes, we have been asked the same question. Oh, you know, do they use generic brands? Because obviously, you know, when you go to pharmacy, you say, do you want a generic brand cheaper? And it's gonna happen. Okay, so it's good to know that you guys still use the same type of drugs. In terms of stimulation protocols, I think you know, a lot of times people when they talk about, you know, affordable centers and everything, a lot of times the comparison goes back to public institutions, obviously. But in terms of IVFSG, do you guys use a standard protocol for all patients, or is it kind of, customized in certain ways?
I think that in the practice of fertility, regardless of whether you're in government institution
Yeah.
or with us, there are a few common protocols that would apply to the majority of patients. The onus is on your doctor to choose the right one for you.
Mm.
So to say that one size fits all is probably wrong. But to say that that shoe will fit the majority of Asians, I think that's probably correct. But of course, you got big Asians, small Asians, da da da. So I think that's important to have that discussion with your doctor. And in IVF SG is a personal consultation with us, where you evaluate your age, your past history, your previous cycles, and then we come to a consensus. We say that this is what we will do, all right? This is what you have done before. Obviously, we don't use the same formula. But basically, it's a modification of a very common protocol. And most of us nowadays use the antagonist protocol.
Okay.
Which is what we call a short protocol. But there have been certain advances in this protocol, which is called the PPOS protocol, which I'm sure many of you listening in will understand is called the progesterone priming ovulation stimulation protocol. It's more patient friendly. There's less injections. So we are able to offer that to our patients that come from maybe government institution, where the PPOS protocol is not as prevalent. But I would say to you that in many countries like Vietnam, which does a lot of cycles, Thailand, who does a lot of cycles, I talk to my friends there, more than 90% of the cycles are PPOS protocol.
Oh,
The
interesting.
advantage, yeah. So the advantage of this is it's more patient friendly. It cuts the costs a little bit, but more importantly is that it doesn't decrease your pregnancy rate, especially when you have a lab that's very used to doing a freeze-all protocol.
Mm.
So coming to the lab, which you mentioned earlier,
Yeah.
we tend to choose a lab that we are comfortable in using. And the results of the lab is very important, and sometimes even more important than the doctor, in my opinion, because they are the one that is going to manipulate your gametes and create life and create embryos. So the lab inverters, they focus on a freeze-all protocol, and we are able to have a very good pregnancy rate. And remember, I said that there are no national average and no national statistics for us to compare. But Virtus is part of a huge conglomerate of IVF centers that's in Australia, that's in Denmark, that's in Ireland, and that's in the UK. Now, our scientific director, the chief embryologist, will very proudly tell you that each year when we throw our data into the pool and they get someone independent to analyze it, the pregnancy rate per embryo transfer for Virtus Singapore in the last 5 to 6 years is better than any of the other centers. So it's something which is very reassuring to the patient.
Yeah.
I think that together with the fact that we at IVF SG, although it's an affordable IVF center, we still tailor the treatment according to your individual needs. Now, a distinction has to be made between affordable IVF and what some people call low dose or minimal stimulation or natural IVF. It's different. When you do a natural IVF cycle, you don't use drugs. You just wait for ovulation and then you collect the egg. But clearly, you only can collect one, max two per cycle. Of course, that drives your cost down because there's no drugs involved. And for those centers, they are able to charge very cheaply and use that as a marketing tool.
Yeah.
But we all know that IVF success is based primarily on the number of eggs that you can get. It's a numbers game. So we do not give excessive dosage because I don't believe that that is the answer. If you have a certain amount of money in your ATM, all right, even if I ask for 10,000, you only got 5 inside, you'll never get the money. So that comes to the proper assessment. So all patients are interviewed, consulted. We look at their history, look at their ovarian reserve. and we tailor this treatment. And so together with a very good lab and together with the lab familiarity with the way we stimulate, I think that so far our results in IVF SG has been very encouraging.
Yeah. You know, I think one of the reasons why I wanted to do this live with you is because of the fact that, lately and the group that we have with IVFSG, they've said, hey, really, I've got good results. And we see a lot of people pregnant, a lot of people who have given birth to babies from IVFSG. And so, from our point of view as a community, I think it's important to share the fact that there's such a center out there. And when you talked about Virtus and everything, people are often surprised because when they see or when they hear affordable IVF, they presume that you're probably working with some, a center that is not popular or not famous or a very like low cost lab as well. So when they often hear that, oh, they're working with Virtus, I think it's usually a pleasant surprise in certain ways to hear, okay, yeah. And I think it's reassuring as well, the fact that now you are also the medical director of Virtus. So we know that regardless, we are in good hands, or, both sides with IVFSG and Virtus. So I think, for anybody who's choosing, this is reassuring at the end of the day. Yeah.
I think at the end of the day, whether we are doing IVFSG or private patient with
Yes.
any of the existing doctors or that comes to Virtus, the main thing is to work together with the lab for the patient to understand what do they want and what we can offer. And then hopefully in this fertility journey, you end up with a lovely baby.
Yeah. At the end of the day, sure. Okay, just now obviously we mentioned a bit about public healthcare, right? A lot of the patients that actually come out to private, okay, are patients who actually come from public healthcare. And I always tell the patients, if you're still young or whatever, go and try public healthcare first because you never know, you may work for you. But obviously for those that it doesn't work and everything, what are, from your point of view as a doctor, what are some of the common reasons that patients exit public healthcare and go into private?
I would divide them into two groups.
Mm-hmm.
Those that, as you say, youngish, they have co-funding, which is an unfair advantage in my opinion.
Mm-hmm.
They have tried KK, SGH, and UH.
Yeah.
And as you know, even in the best center, nobody can give you 100% success.
Yeah.
There will be a certain percentage that would fail.
Yes.
We remember what Einstein said: if you keep doing the same thing over and over again and repeating the same thing over and over again, you're probably lunatic. And many of them would, after one or two tries, they would choose another lab.
Yeah.
Now, the reason for choosing another lab may not be based entirely on the results. Some may leave earlier because of the system.
Yeah.
And again, it's no fault of the government practice. I've trained there. Every other IVF doctor trained there. We know how it works. It's a machinery that is very administrative based. So a patient that sees me in IVFSG or my own private practice, I can say, I'll start today.
Mm.
In fact, nowadays, there's this thing called random start where we, in theory, start anytime. And there'll be no waiting list. Now, I'm not sure about the waiting time in government hospitals now.
Mm-hmm.
I know that in some stages, it was a long waiting list.
Yeah.
So patients are saying, no, you need to go through IUI first. You need to do this, do that. Now, albeit useful for some selected patients, but we also know that those methods to try to help you have a baby actually pales in comparison with IVF. Now, IVF has its own quirks. Costs is one thing, injections, etc., etc. So you need to have that conversation. So a lot of patients leave government practice because they want a shorter waiting time. They also want the same doctor to see them, or for that matter, a doctor to see them. Because I think that in some government institution, the scans are done by sonographers, which are very good and very accurate, but you still need that personal touch. And don't forget that fertility journey is very personal.
Yeah.
It is something which you have to sit, look them in the eye and say that I'm doing this for you.
Mm. Yeah. It's true, and I think that it's very hard to explain what you would offer or what you would get in a private clinic setting if you haven't tried it. And you know, I went through the public route as well, and I started public route thinking that that was the norm, and expecting that that is what I should be getting, and that's the best that I can get. You know, until then, obviously, after that, exiting and going to private, then it's a big surprise that, oh, you know, oh, I actually can get a lot more, obviously for a bigger cost in that sense, but you just start to have faith. I think it is one of the biggest things as well. Prior to that, it was really you're just being led wherever they tell you to go, you just go. So I think then suddenly when you go to private, you regain control, and I think that's one of the biggest things that was apparent to me in that sense. Yeah.
Thank you for sharing that. I think what you just shared is precisely what most of us in private practice strive to do, is accessibility and availability for the patient to ask the question,
Yeah.
to have that communication channel, which again, no fault of the government practice, because patients, they cannot do that,
Yeah.
right? But because we are having that luxury to have maybe a bit more time to talk to our patient, a bit more personal interaction,
Yeah.
we can afford that emotional part of the journey, which, in my opinion, very, very important.
Yeah, 100% agree. And I think, you know, one of the things that we try to advocate is that, you know, for a lot of them who are exiting public, right, they don't know how to ask questions at that point when they go to private. And so a lot of times they go in scared to ask questions. And so we keep telling them, no, you know, now you have the opportunity to ask whatever you want to ask. Go and write down your questions beforehand, then go into the meeting just with your whole notebook and just ask whatever you want. And they're always scared because in public, I could not do that. The doctor won't spend his time answering questions. I feel very bad, isn't it? And then so going to private, so that's what we're trying to advocate as well. Please go and ask questions.
You have hit the nail on the head again. This is the exact situation that we get. It's like we ask them, do you have anything else to ask?
Yeah.
You should, you know, just,
And then they're
heads
like,
up.
no, but you see, the problem is that they say no, then they exit the room, and then they start messaging, or like, shit, I should have asked all these questions and everything. And then so we're like, then just go and ask again, it's fine, you know. But that's the thing.
In IVF SG, we have a nurse that is very responsive. I'm sure in the centers as well. So you can throw those questions with WhatsApp, and it's all confidential, and we'll just address those questions so that you get reassured lah. We're
Yes.
walking with you lah.
Yeah. You know, over the years, I absolutely agree with what you just said. I think that nurses of IVF centers are so well trained to a certain extent that they are, you know, so knowledgeable that they know exactly how to answer whatever question you ask them. And if they don't, they will go and ask the doctor straight away. And I think that is something that you need to place your trust as well. The fact that these nurses are very well trained. And they're not newbie doctors who don't know, or newbie nurses that don't know anything in this net. So yeah, the trust has to be there.
I always say there's a tripod in IVF. You have the lab, you have the nurses, and you have the doctor.
Yeah.
All three are important, equally crucial to your journey in fertility.
Agree.
Yeah.
Yeah, 100% agree. Okay, so, now for patients moving from public to private, right, just to address this bit, you know what, I mean, we obviously talked about a lot of things where you got more time and this and that, but how important is it for them to bring their proper history to this new doctor for them to assess, you know, because obviously a lot of people in public, I don't have a lot, I've never recorded, I didn't know I had to record in this and that, but what are things that, you know, they should be doing when they come and see a new doctor?
It's a very good approach to bring whatever that you have on you. For example, like your blood tests, your scans, if you have done a tube test before, if you have previous treatment before, so the protocol that they use, the response, the fertilization rate, etc., etc. You have all those information is useful information for us. Because, as I said to you before, it's not one size fits all. If you identify, because we learn from your failures, we learn from our colleagues, and no one is going to say that my method is the best. You can only do it this way. I personally don't believe in that. It's about adjusting and modifying what didn't work for you, and hopefully it will lead to success. So bring all the information that you have. It may not be possible for us to dissect all those information with you in a short consultation. But majority of us would take time to read through. And then if there are things that, hey, I think we should have discussed this, then, during the next consult, we'll dwell on those points. So it's important. You're right.
Yeah. So then, okay, obviously, then now not talking about specifically public healthcare patients, but more, say, patients anywhere. If they are discouraged from previous unsuccessful cycles, how important is it to get, a second review or, a fresh review or second opinion in that sense?
I think that all of us have certain inclinations and certain strong points. So it is always useful to get another perspective. The person that is treating you for the last 5 cycles may not see something that was there that is hidden. So you have a fresh perspective. So as much as I'm encouraging you to stick to the same doctor, which has its good points because he knows a lot of your cycles, a lot of how your body responds. And if that doesn't work out, it's not wrong. And none of us as doctors would begrudge anybody who say that, look, you didn't get pregnant with Dr. Yeong. Why do you go to this person? Why do you go to that? I don't think that's the case. At least for us, if you're pregnant, you tell me you're pregnant, I'm happy. But it's always good to get a fresh perspective. So don't feel shy. Don't feel that, I'm obligated to this doctor, I'm married to his clinic, etc. No, it doesn't work that way. I think all of us do want you to feel comfortable.
Yeah. No, I think it's important for the doctor to say out. I think, people are often, and I see ladies in the group who says that I don't dare, I don't dare go and get a second opinion. And I'm like, huh? What
If
do you
you
mean you
paiseh
don't
to say
dare?
that this doctor is in the same
Yeah.
building as me, I think, look, we are all adults.
Yes, agree. In terms of, patients, so somebody asked me this just now. For patients coming to IVFSG, is there to say that if you've got low MH, we won't accept you, or is there certain things where they say you're not suitable for IVFSG?
So when I decided to run IVFSG, and I made it a point to my colleagues at that point that we shouldn't have any restrictions. Because otherwise you'll be selecting out some patients that you can't help. And what makes us different is that we tailor the treatment. It's not because I'm going to give you less drugs or more drugs. So as long as you have the ability to produce eggs on your own and you want to have a child on your own, we have taken in women with AMH that's low, that are post reserve. We have taken in 44-year-old. In fact, I share with you that our patient here, one of them is 44 and a half when she came. She delivered when she's 45. And that's through just doing the usual stimulation here. So age is not a limiting factor.
Okay.
As long as they want to try, we are here to help. A low ovarian reserve is also not a limiting factor, but we have to be mindful and be accepting that you have a low ovarian reserve. It means that we may not get that many eggs to start with. But that applies to you regardless of where you go.
Yes, exactly. Interesting. So wow, 45, 44, 45-year-old. That is no, that's reassuring to a certain way that at least we know that it's not limited to just younger ladies, and not so suitable for the older ladies as well. Yeah. So okay, just looking, trying to look at the pricing that you guys have. So your pricing works in a bundle costing where, for example, egg retrieval, I see it's 12,486, and that is a lump sum cost. There's no additional, that I see it covers consultations, blood test scans, simulation medications, one egg retrieval, and so what doesn't it include? I should say.
Right. So obviously, when we want to tailor the treatment to best possible results, there may be certain aspects of adjuvant therapies which will be discussed. So there may be some evidence that certain things may be useful.
Yes.
For example, like aspirin.
Like intralipids, if I want intralipids or things like that.
So that cannot be part of the package.
Yes.
Because not everybody needs it.
Yeah.
But after discussion and you reading, the patient reading the literature and doing their own, and asking ChatGPT or Claude, which You can come back to us and say, yes, I am not interested, which is fine.
Yes.
Or you can come back and say, look, I am interested. And then I say, look, we have to make you pay for that bit of it.
Yeah.
Add
Okay.
someone else.
So there is the option that says that. So it's not such that in a way that if I want it, I can't get it. I need to go somewhere else, or like go find another doctor. But if I want it, there is that availability that I can
Correct.
still get it. Okay, that's good in that sense, because at least I know I still have the option, and the option lies with me. I think,
The power still lies with the patient to decide.
Yeah.
The autonomy for you to decide. And
Mhm.
the literature is available. You can ask
Yeah.
whatever it is.
I mean, I think that our bunch of ladies have gotten so educated on
Yeah.
the ones that have, failed a number of times. They have put in so much effort to ask around and figure out what else is out there that, sometimes they come back with new things for us and we're like, oh, never heard of this new thing, like stem cells and PRPs. And it's like, so we're like, okay, there's a lot of things out there. But we are also wary to know, to let ladies know that there are a lot of things out there that, don't have enough evidence, as you say. So I think it's a conversation to have with your doctor, to ask the doctor for his medical advice. I think that's very important. You need to trust your doctor to give you the best advice, but you also need to know that there are a lot of things out there that people can say that they try and it works and it's that, but it may not work for you. So
it may be anecdotal, it may sound very sexy, but the good thing is that because we live in Singapore and we are very regulated,
yes,
so some of the treatments that you mentioned is actually stated very categorically that, look, this is still experimental and we are not going to endorse it. If we don't ministry's endorsement in some of this treatment, I think it's a bit brave of the doctor to just recommend it and to do it. We have to, based on science, and of course I think all the centers in Singapore, we don't want to run into trouble with the ministry. So it's good that Singapore has all the regulations.
Yeah.
But it's also good that the ministry have feedback sessions with us, and then if there are new things, we have to evolve.
Yes. I mean, agree. I think that, at least the good thing is that we are very regulated here. You're not going to have a lot of mishaps or anything here. But there are obviously ladies who try different things in different countries and this and that, and they come back saying, hey, it works for me, So there's always a lot of different things out there. Yeah. That's the thing. Just now we talked. We talked about a lot of the financials, a lot of the protocols, medications, and so that. But the last part that I want to do tonight, before we end, is that I want to talk a bit more about the emotionals. So obviously, you've done this for so many years. How do you, because of experience? But how, what is one thing that you want patients to, know, in the sense that, if you're feeling discouraged and this and that, what is one thing that you probably want them to know?
I think the emotional part is always very tricky. I always tell my patients that the journey can be very short. You can be very successful quickly. But for a lot of patients, this journey can be quite long. If you are committed to it, we are also committed to walking with you. And as much as success rates or a successful pregnancy or a successful embryo transfer is the outcome measure that we all measure, it is also the emotional support and also understanding where you stand along the way and knowing that you're alone. I think that's very important. So I think for our team here, we always want to give the patient the assurance that, if any point you feel emotionally drained, we can always turn to our counselors. And I think these people are well trained to help the mental health, the mental support of a couple, for example, like going through many cycles, very fragile. So it's about motivating and, continuing to support them through the journey.
Based on your experience, can you tell when a couple is, fragile?
Sometimes the couple dynamics are quite,
Yeah.
um,
So in a situation like that, how would you usually deal with it? I mean, very honestly speaking, it's not easy. It's not easy. I think, from a doctor, a lot of people think that the doctor comes from a very medical point of view, but emotionally, you see all this on a day-to-day basis. It must, eat into you somehow.
I think that maybe that's the reason why I think the fertility has never been defined as a disease
Yes.
until recently. So I also tell my patients, you guys are healthy, you just want to have a baby.
Yeah.
So this desire to have a baby must always be in the back of your mind, knowing that you guys don't have cancer, you don't have something that needs to be operated on. Not all, some do. Some.
Yes. Yes.
So in that context, they will be more grounded to say that, look, if it doesn't work, I always tell them, you still have one another.
Mm.
But of course, that statement doesn't stand true all the time.
Yes. Yes. Yeah.
Yeah, but you know what I mean.
I know. I know. Now
Always,
we.
always, you must always have support for each other,
Yeah.
and it's a journey that we are walking with you, and etc.
Yeah. No, I think a lot of times, and we've mentioned this many times, but sometimes couples forget the reason why they're having a child. The love for each other, is
Yeah,
the ultimate reason why they're
yeah,
having this child. And
yeah,
a lot of times we get so frustrated or we get so caught up in our own journey that we often forget.
yeah.
And we're only looking at end goal, but in that end goal, you also need to sustain the relationship and make sure that at the end of the day,
Absolutely.
when the baby comes, you've got a
Yeah.
solid foundation there. Because if the foundation has crumbled throughout the years to get that baby, then there's no point as well.
I'm sure in your contact with your patients and your friends and things like that going through this journey, I'm sure you have more than one couple telling you that sex is a chore.
Been there, done that. It got to a stage. Yeah, but it's true, I think we lose the essence of everything when we go through it, that we forget we forget a lot of things. So, and getting it back is hard as well, because you get used to doing all those things, and when it comes time that you finally have the baby, you realize, what do I fall back on? Yeah. So
You cannot lose that essence, which is the relationship to start with.
yes,
Totally agree with you.
absolutely. This could be a whole conversation for another day. But yes, almost to the end, for someone who is considering fertility treatments but unsure where to start, they are thinking of exiting public, or, they even like first step, I want to try something new, where can they, how can they do this, and where can they start?
You have choices, obviously.
Mm-hmm.
Find a good fertility doctor that will listen to you.
Yeah.
Go through whatever you've been through, and then have an assessment about your health, your husband's health, and then work from there. And then from there, you can choose which lab you like, learn about the success rates, talk to the embryologist, find the package or find the treatment package that suits you.
Yeah.
And I think that's the good stuff.
Yeah, agree. So, today's talk, was not so much medical based, and we can do that another day because I'm sure you have lots of experience to share with us. But we really wanted to talk about finance, because I think it's a topic that we often don't talk about. We often kind of just, and I think it's a bit more sensitive in context when we talk about IVF and everything, but it's a big portion. And therefore, today's topic is really about, affordable IVF, what's included, what's not included, and what you need to know before choosing a center. So thank you, Dr. Yeong, for your precious time. I'm sure you've had a very long day today. Thank you so much for your time. We really appreciate it. And, we hope that we get to chat with you soon. But thank you, everyone who's been listening. We will put this recorded video up next week. And so you can slowly listen. And, if you want to look for Dr. Yeong, where do they find you?
You can find me through IVFSG. You can find me through
Yes.
clinic.
Yes. And where are you located? Where's your clinics?
I'm at Royal Square. My clinic's name is Yeong Clinic.
Mm-hmm. Okay. And IVFG is at
Pacific Plaza.
Okay. So very convenient locations, can go shopping before, after, this and that.
Lots of good food as well.
Exactly. All right. Thank you, Dr. Young, for your time. Have a
Thank
good
you,
rest
Kim.
today.
You are always a wonderful host.
Thank you. Thank you so much. Thank you, everybody. We'll talk soon. All right. Thank you. Good night. Bye.